Hey guys, welcome back. Today's video is all about a topic that I've been asked a lot of times over the last few months, especially as we've all been working at home. Now today's video is all about when we should use heat or cold for which type of injury. So let's go ahead and have a look. So let's talk about when to use heat or a hot pack first. Heat works really well for chronic conditions like osteoarthritis, or if you have a condition where the pain lasts longer than 6 weeks. Now, there are exceptions to this rule, so just take this as a general guideline, but always make sure that you're asking your favorite healthcare practitioner to confirm the diagnosis. Heat also works really well for relaxing and loosening tight muscles. Strains and sprains, you can actually use a combination of hot and cold, which I'll talk about a little bit later. And heat, it primarily increases blood flow to the area, so it works best for something that's stiff or achy, like a tight low back in the morning. You never want to use heat for acute injuries. So let's say you have a disc injury, you pull your back, you lift something, you get a sharp pain in your low back spine. You want to use ice for that instead of heat, because if there's swelling, it will actually make the swelling worse. So speaking of ice and cold pack, this is what we want to use for acute injuries like the spinal disc injury I just talked about. An acute injury is typically less than 6 weeks old. It reduces swelling and inflammation, ice does. It works a little bit better for gout flare-ups than heat because it is an inflammation. Strains and sprains, again, you can alternate hot and cold. Tendinitis, which is basically an overuse injury, and also headaches and migraines, ice works quite well to relieve pain when you use it on the temples. Now, we do need to talk a little bit about safety. You should always be using a cloth or a towel to protect the skin from hot or cold. We don't want anyone burning themselves or getting frostbite. Typically, the general time frame for any sort of hot-cold treatment is 20 minutes on, 20 minutes off, and you can actually repeat that for several rounds throughout the day if you'd like. For sprains and strains, you can do the hot and cold at the 20-minute intervals. So you do heat for 20 minutes, cold for 20 minutes, heat for 20 minutes, cold for 20 minutes, and just continue. But most importantly, if you're not sure what's caused your pain or how to treat it, you do need to consult a medical professional so that you're not doing something to make yourself worse, because the last thing we want is someone to have even more pain. And that wraps it up. Thanks for watching, guys. I hope this answers any questions that you've had about using hot or cold. And don't forget, if you're not sure how you've injured yourself, please consult with your favorite healthcare practitioner to make sure that you're not going to do something that's actually going to make you worse. Last thing we want is for you to be in more pain. Go ahead and leave us a comment below if you've got any questions or if you like the video. And if you'd like to subscribe, we'd sure appreciate it. And check us out on Facebook for more content like this. See you later.